Hello everyone, let's talk about a very important topic, sciatic foramina, and very important structures pass through these sciatic foraminas. There are two of them. One is your greater sciatic foramina, GSF, and one is your lesser sciatic foramina, LSF. So, before starting, one must be very familiar with two of the ligaments relevant to this topic. Of course, there are many other ligaments present in this area, plenty of them, but these two um, are very important for this topic. One must be very familiar with them. So, the two ligaments are, the one is your sacrotuberous ligament, STL. Yeah, this one coming from your sacrum till your ischial tuberosity over here, and one here, the small one, is your sacro spinous ligament. Yeah, coming from your sacrum area and going towards the spine. Yeah, over here, ischial spine over here. So the long one, the big one, is your STL, and the small one over here is your SSL. Yeah. So once we know these two ligaments, let's discuss how two foraminins are created. Since it is a pelvis, it's a bony structure over here. They don't have no foraminas over here. But due to these two ligaments, they make two foraminas. So if you can imagine, this is a posterior view of the pelvis, looking from the back of a person. So if we are looking from a back posterior view of this patient or person, we can see this STL is coming all the way from sacrum and inserting over here. Yeah. And your SSL is a bit inside, anteriorly to this STL, your SSL over there, uh, going across like this. So hence two foraminas are created, as you can see. A big one over here, this one is your greater sciatic foramina, and below over here a lesser sciatic foramina is created because of these two ligaments, greater one, smaller one. Yeah, because of these two ligaments. So one must know these ligaments very it's very important to know this. On another view, lateral view, it helps to understand these foramina. This is a left lateral position, a left lateral view. Here is your sacrum going down, and here's the bone. Now here is your greater sciatic foramina created over here. This one over here from your sacrum going till down till your ischial tuberosity. This one is your STL. Yeah, sacro tuberous ligament over here going down, and over here we can see we have SSL, sacro spinous ligament. Yeah, going from your sacrum till your ischial spine over here. Yeah, so hence making two foraminas, a greater one, a lesser one. All right, talking about the boundaries, if we talk about the boundaries, let's see. If the greater sciatic foramina is over here, posteriorly we have your STL, sacrotuberous ligament, and inferiorly somewhere over here we have your this thing, SSL, sacrospinous ligament. For lesser foramina, again we have posterior boundary covered by STL, sacrotuberous ligament, and superiorly over here somehow we have this your sacrospinous ligament. Overall important thing is, because of these two these two ligaments, we have a greater sciatic foramina and we have a lesser sciatic foramina. Through these very important structures passes by, which we will discuss in a moment. Another view, anterior view, it might help to understand. This is the pelvis. Here we have the sacrum. From sacrum is going your SSL, sacrospinous ligament, sacrum and spinous for spine, going from your sacrum till your spine. So this is your sacrospinous ligament, and over here we have sacrotuberous ligament. Is, of course, it is located at the back side of your sacrum. Posteriorly, it's coming from the posterior side of your sacrum and going and inserting over here in the ischial tuberosity. So if we look at this diagram, we can easily um, find out two foramina have been formed. One over here, this is space, it is the greater sciatic foramina, and one over here is created, this is the lesser sciatic foramina. So very important, because many important structures will pass through these foramina. So greater sciatic foramina, here is your lesser sciatic foramina, created by these two ligaments, sacrospinous ligament, and over here sacrotuberous ligament. Very easy to remember, because initial sacro is for sacrum, and where they are inserting gives the second letter of the this mnemonic, SSL or STL, whatever. So this is why very important. So we get two foraminas, greater and lesser. Again, let's see. This is the posterior view, the location of the on this one, STL, sacrotuberous ligament, STL, coming from your back side of posteriorly from your sacrum and inserting on the back of your ischial tuberosity. Whereas your another one, SSL, is coming from, this is anterior view, coming from your sacrum inside, anteriorly from your sacrum and inserting to your spine. All right. So, and this is your lateral view, sacrospinous ligament, a sacrotuberous ligament coming all the way, see, from your sacrum and going towards your ischial tuberosity. Here is your ischium, and here is your tuberosity, ischial tuberosity of your bony part of pelvis, ischium. And here's the spine, and sacrospinous ligament gets inserted into the spiny part of this area. So let's talk about the structures passing through your greater sciatic foramina and your lesser sciatic foramina. Very, very important. Now let's talk about the greater sciatic foramina. Here's another diagram which I've drawn to make you understand much more easily. Here as we can see, we have the pelvis, and here I have drawn two foramina. One is your greater, one is your lesser. Now the greater foramina itself is divided into two, suprapiriform or inferior piriform, because this is the piriform muscles, a piriformis muscle, as you can see, coming from inside of your sacrum, anterior view of your sacrum partly, and coming and inserting into your greater trochanter of your femur over here, you can see. So this is the piriformis muscle. Now this piriformis muscle is relevant for the greater sciatic foramina, not for the lesser sciatic foramina, because this piriformis muscle divides your greater sciatic foramina into two half, above and below. So structures which pass through above piriformis, they are different, and structures passing through this part of the greater sciatic foramina, that is below piriformis, they are different. Piriformis doesn't have nothing to do with your lesser sciatic foramina. So many students get confused with this, but important thing is greater sciatic foramina itself is divided into two halves, above and below, by the muscle piriformis, which is inserting on the lateral trochanter, on the greater trochanter, sorry, of the femur. So let's talk about the structures passing through these two. Now if we talk about the above, the piriformis in the greater sciatic foramina, so the structures, content of the greater sciatic foramina would be above and below. So let's talk about the above. What are the structures passing above piriformis? One would be, since it is passing above, very easy to remember, is superior gluteal vessels, that is artery, vein, and plus the nerve, superior gluteal nerve. Yeah. So as we know, superior gluteal nerve is for your gluteus medius and minimus. Yeah. And so, and below piriformis, so it's easy to remember. So all the structures which pass through the above piriformis, supra piriformis, are simple, very simple, is superior gluteal nerve, artery, and vein. Yeah. And since we know superior gluteal nerve is the one which goes for medius and minimus. Now let's talk about below the piriformis, piriformis foramina. Here, this area. From infrapiriformis foramina, because itself we can call it a foramina, or below piriformis, structures passing through would be, since we talked about the superior gluteal nerve, artery and vein, let's talk about the inferior gluteal artery, nerve and vein. So structures passing, very important structure passing through infrapiriformis area, this area of the superior gluteal of the greater sciatic foramina would be your inferior gluteal artery, nerve and vein. And as we know, inferior gluteal nerve is the one which goes and innervates your gluteus maximus. Yeah. Superior gluteal nerve is for gluteus medius and minimus, and inferior gluteal nerve is for gluteus maximus. As we know, we have these three gluteal muscles: maximum, maximus, medius, and minimus. So very important not to confuse them. Superior one is for the middle and medius and minimus gluteal muscle, and inferior gluteal nerve is for gluteus maximus. What else passes through inferior gluteal, this areas below piriformis in the greater sciatic foramina is the inferior internal pudendal nerve, artery and vein. Again, internal pudendal, very very important, um, vessel and nerve, internal pudendal, and the most important thing, most important nerve, one must remember, your sciatic nerve. Yeah, sciatic nerve. So the question can arise, where the sciatic nerve passes from, above piriformis or below piriformis. So the answer is it passes below piriformis in the greater sciatic foramina. All right. So this is about the greater sciatic, lesser sciatic, greater sciatic foramina, and plus another few structures passes through, is your or your quadris femoris nerve also passes through this area. All right. Now let's talk about the lesser sciatic foramina. Lesser sciatic foramina is the foramina over here, which I've drawn over here. You can see lesser sciatic foramina. From lesser sciatic foramina, again, as we know, as we talked about, through the infraspinatus, infrapiriformis foramina, we have the nerve, vessel and artery of the internal pudendal. Same internal pudendal, after crossing from your lesser, this infrapiriformis area, goes and travels into back into your lesser sciatic foramina. So internal pudendal is the one which passes through both of them. Yeah. And even obturator internus nerve also passes through that, but internal pudendal is the one most important which passes through both of the foraminas. So overall, these are the structures and anatomy about your sciatic foramina. That's all. Thank you.